Hi guys, welcome back to Health Focus. My name is Amy. The current situation of cardiac failure and hypertension is leading to so many issues in the health sector, and we are seated with our famous cardiologist to help us analyze on what to do in case somebody has a cardiac failure. Welcome, Dr. Ndwiga.
Thank you so much. I appreciate this opportunity, Amy. Thank you.
Karibu sana. So in the situation, somebody has found that they have cardiac arrest. Or rather, let's get to know what cardiac arrest is.
Cardiac arrest basically means cessation or an interruption in the blood supply to the body. So this can happen very abruptly, in which case it is catastrophic and requires very urgent care. Generally, cardiac arrests don't happen without preceding one's signs and symptoms and warnings. And one of these would be that prior to the episode or the calamity or the attack, there's been some signs which would actually indicate that someone needs to urgently address them, or something urgent or something catastrophic might actually happen. Cardiac arrests or heart attack, so to speak, are quite common above the age of 50 in people who are hypertensive or diabetic, people who are obese, or have high cholesterol. If in the family, when you consider the family history of the client, you find that there's been history of heart attack in close family members or high cholesterol in family members. If you smoke, that also increases the risk of developing a heart attack. What generally happens is classically what's been described in terms of talking about a cardiac arrest is that someone is talking about severe chest pain right in the middle of the chest that feels like an elephant is sitting on your chest. This can be accompanied by a sense of impending doom, that someone actually knows something ominous, something dangerous, even a loss of life is coming upon them. And if something isn't done quickly, they could even begin to lose consciousness. Their pulse or heart rate could go very low, and they can actually collapse.
Quantify quickly.
When a heart attack happens, usually we have what is known as a golden hour within which we need to take care of that client. Depending upon the extent of the heart attack, because this is talking about the blockage of the arteries of the heart. If a minor artery is affected, you may only just get chest pain. If a major artery is affected, or if there's abnormal rhythms that follow the blockage of the artery, we can actually get total cessation of blood supply to the brain, to the rest of the body, and the person can actually collapse. So by and large, we need to take care of that patient within an hour. If we can get help within the first 15 minutes to 30 minutes, better. We stand better chances of actually restoring that person. In this case, we talk about minutes, meaning muscle.
What kind of help do they need in the first 15 minutes?
We'd actually prefer to lay them down on the ground, confirm that they actually do have a pulse, they're breathing well, they're conscious. If we can, we actually prefer, if there's medication available, there's medication we actually offer to the client, including blood thinners, we want to give them immediately, and medication for cholesterol. Sometimes we actually give oxygen, and sometimes we give medication to control the pain. We would prefer, if possible, either an ambulance is called with paramedics that are trained in this, or the patient is ferried quickly to a hospital. So the role of the general public would be to recognize these signs and get that client as quickly as possible to hospital.
Okay, all right. Thank you so very much. Is there a chance that a person will get this cardiac arrest or heart failure without knowledge whether they have hypertension, whether their cholesterol level is high, whether they have any issue that could make them be predisposed to having this cardiac arrest?
Without risk factors, these things are actually rare. They do happen, but they are rare. We do know that apart from things I've mentioned age above 50, generally above 65, but you're seeing younger and young people getting heart attacks, as you're saying, above 50. Obese clients, people who have high blood pressure, who are diabetic, who smoke, take a lot of alcohol, people who are overly stressed, not resting well. All these are risk factors that actually lead to the risk of heart attack. Usually, a client will actually be complaining about, I'm running short of breath when I walk, or I have this pain that comes when I'm active, or I actually have acidity that comes when I'm active. All of those are signs that you might be at risk of heart attack.
When you're having risk of heart attack, what are the things you're supposed to do as a person, as a patient, as a public?
We're encouraging people to know their numbers. The numbers have to do with their weight, their height, that gives us a body mass index. Encouraging you to know your blood pressure and your sugar. We're encouraging you to exercise. We're encouraging you to actually get a checkup done regularly.
Thank you so very much, Dr.